So moving to the United States, and you were already a physician, how did you end up in endocrinology? Where did that start?
During my residency, we had to go through different rotations, and I was trying to think and envision what would be my life like in the future and what I want to study more. And I knew that I wanted something brainiac in a sense, and I liked rheumatology a lot, but that time rheumatology was very sad world. They didn't have any medications, and all of those patients with rheumatoid arthritis or lupus, they were slowly dying with inflammation because there was no biologics yet.
Wow.
And I didn't want that sadness in my life and sadness that I couldn't help my patients. Then I had a rotation with Dr. Glick, my mentor, and I learned a different world because all of his lipidology world was preventive medicine. And a lot of his treatment included dietary changes. And I felt that it's clicked in my mind. And I felt that that's what I want. And to be a lipidologist, we don't have separate fellowship at this point. So path to that was endocrinology. And as I started doing endocrinology, I learned that I love that because manipulation of hormones helps people to feel so much better with just tiny molecules that you introduce in micrograms and milligrams. And suddenly person's whole well-being changes and they feel so much better.
So explain, what is a hormone? I don't think majority of people truly understand what a hormone is. They talk about, working on my hormones or I'm interested in my hormones, but what are they? What do they do?
So it's interesting that there is perception of people that hormones are female and male hormones. And that's why when they're talking about working on hormones, they mean their own female and male hormones. But in reality, any chemical that goes between one organ to another and helps certain functions to be created, that is a hormone. It's your chemical that travels from one part to another and helps to create certain outcomes. For example, thyroid goes from thyroid, which is like a butterfly type of hormone on the lower part of the neck. It gets released, it travels all over the body, gets connected to the cells and nucleus of the cell, and makes that cell produce certain outcomes that has profound effect on our body, including temperature regulation, metabolism, and weight, the energy, hair growth, and gastrointestinal tract, and all of that. All of that is related to thyroid hormone.
Thyroid hormone is probably the most talked about hormone, but I don't think people understand the families. I always say, I'm like, thyroid hormone, your sex hormones, and then incretin hormones. And right now, the craze of GLP-1s and understanding that incretin hormones are a huge piece that I think hasn't been talked about.
Correct.
And now it's really coming to the surface of, we know insulin and blood sugar, but then you add in GLP and all these others that are very, very important.
People will start talking about glucagon soon because we have a retatrutide coming on the market soon enough that works not only on GLP-1, GIP, which are incretin hormones, but on glucagon receptors as well.
So incretin hormones, what would you, if you were to put it into like 2 sentences, what would be, what are they? What is an incretin hormone? What does it do? Like, what's the goal of them?
Those are hormones that produced by your guts as a result of you eating. It's literally triggered by your food, by your meals. And they help with the blood sugar regulation and the whole gastrointestinal tract during the food consumption. So
why do you think that today there's such a deficiency in so many people having, gut microbiome issues? This is another thing Dr. G is big on and so important, but gut microbiome issues that then precipitate these incretin hormones to be out of whack.
So a lot of incretin hormones actually produced by microbiome, by our own bacteria in the guts, including Akkermansia.
Yes.
And that if your gut microbiome is disbalanced, then you may have true deficiency of the incretins. And that's why many people will benefit from having on board any version of them.
Yeah. And small, high, it depends. So in the world of endocrinology, we've seen these GLPs in a different space than I think where a lot of the general population is seeing them today, but they're incredible drugs for diabetics.
We started using them back in about 2006. I remember when they came out first from Gila Monster. It was very unique story that originally it was found in the saliva of Gila Monster. And Gila Monster eats only like twice a year. Can you imagine?
Yeah.
And they don't need incretins all the time. They don't need insulin all the time because of that. But when they eat, the saliva produced, and that saliva has incretin that helps the blood sugar regulation after that particular meal.
Really?
Yeah, that's how exciting.
Little monsters, no way. I did not know that. So if there was something you would tell patients about GLP-1s and taking them, as well as ways to support your body in making them, what would that be?
So I usually suggest to start with smaller doses. If we can to do microdosing, it's even better because your regular doses are great. They were studied on fair amount of population, but the original studies were on diabetics who definitely require high amount of GLP-1s and GIPs. But regular people who are not diabetics, they frequently benefit just with smaller dose. If you have nausea, vomiting, that's a common side effect. It means it's a high dose for you.
Yeah.
Go back and try to use smaller doses, and that will help you to tolerate better and still benefit from the use of GLP-1s.
Do you think of it kind of like a small hormone replacement? Like when you think of like giving somebody estrogen or thyroid replacement, it's very
true because it's just different hormone. And as said, when we are talking about hormone replacement, we frequently go back to thinking about the female-male hormones. But here we're just replacing our own GLP-1s or GLP-1 that's missing or not effective.
You explained this to me a long time ago, a few different visuals that I remember and when I was learning hormones with you. And one was that hormones are like a symphony. And you would explain to me like when one shifts, the rest are going to follow. And you really are trying to get them in homeostasis or in balance. And feedback loops. So feedback loops, what does the general population typically not understand about manipulating hormones and how the pituitary or other glands, it's all a inverse relationship, but what is like something that I feel like most people don't understand about feedback loops?
So recently I was at Adrenal Insufficiency United conference, and when I was preparing for that, I created interesting visual about adrenal gland that is the place where, or you can think of that as a factory.
Okay.
So factory creates the hormone, and here we'll talk about cortisol. But cortisol is under supervision of different bosses. One boss is your hypothalamus, and on top of that boss is hypophysis.
Okay.
And if you have problem with either of the bosses working, your factory is not going to be working properly. Or if your factory is destroyed or malfunctions, then you will have problem with actual production of cortisol. So fact of those presence of those bosses, that's your feedback. Because your bosses, they know how much cortisol you make. They know how much of material you produce as your factory. But having those bosses in line and receiving and sending the messages to the factory, that's your feedback.
I love that. Cortisol. Let's talk about cortisol. Why is cortisol been the villain, but it's not? Cortisol is so incredibly important, but it's become, people are talking about their stress response hormone and that they need to keep their cortisol down. So tell us about cortisol.
So cortisol is our glucocorticoid. It's one of the hormones that helps us to keep blood glucose or sugar to a normal level, and it helps to bring it up because we have insulin that helps to bring the glucose down, and glucocorticoid is one of these counter-regulatory hormones that brings the glucose up. So that's main function. But in addition to that, cortisol, of course, works on many other many other levels. And yes, it is part of our stress hormone. So imagine if you have a bear, and bear is after you, your body needs to be ready to run away. So to do that, first response from adrenals will be actually catecholamines. They're your epinephrine and norepinephrine, and they will make your heart rate to go up, your muscles, and so on. And then in a few minutes, your cortisol kicks in, because cortisol will help your muscles to have enough of energy to run, and because it will bring your blood glucose up, and plus it can help us to bring blood pressure up, so you can have enough of the blood supply to run efficiently from the bear.
And survive.
Yes, but problem that now the bear comes in different forms, and we have, yes, we are getting stressed not just a couple times a day, but we're getting stressed constantly from all different stressors that are around us. And stressors could be emotional or physical or even chemical, or whatever food we eat could be actually a stressor for our bodies. All the toxins that come into our environment, through our environment, that can be stress for our body, infections and so on. So because of that, frequently our first response, our body's response is to creating more cortisol. And if we have more cortisol, that's when it becomes a villain, because that's when you have trouble falling asleep, you have more rumination and thinking about things, you cannot shut your brain down, you start gaining weight in your abdomen area, and instead of being anti-inflammatory, that's what function of cortisol at smaller amounts, it becomes pro-inflammatory. And so that's where many people try to lower the cortisol and try to fight it. But in reality, we just need to regulate it. We need to put those bosses and the factory into balance, and then it will be into alignment. That's when they will start working into your benefit rather than against you.
I think that's the key. So what would you say to somebody who has chronically high cortisol? What are tips that you have seen in your practice with someone who's not in the later stages of adrenal burnout? They're in the earlier stages. They feel like they can't sleep. Their blood sugars are dysregulated. They might have like reactive hypoglycemia. That's a big one. People don't realize like they're hangry because their cortisol's up and down. But what would you tell them? Dietary, lifestyle, sleep, supplement, like what's some big things that you would recommend?
So there are a lot of different things we can address, we can suggest. Simple stuff, just doing box breathing. You breathe in for 4, you hold your breath for 4 counts, you breathe out for 4 counts, you hold that for another 4. So you have your box breathing, and that box breathing helps you to actually activate your vagal nerve, and vagal nerve helps you to rest and digest rather than being in fight and flight. And that as well can help us with cortisol regulation.
And it's free. That one's free.
Yes, find yourself hobby.
Yes.
That's, again, I found that painting for me is very relaxing, but it doesn't have to be painting. It could be any hobby that puts you into present and helps you to just relax eventually. So listening to music, dancing, exercising, going for a walk, going hug the trees. All of that is very...
Hug people.
Hug the people, yes.
You always would say if you work with your hands, do something with your mind. If you work with your mind, do something with your hands. It's a form of like meditation, and it is very true because we use our brains nonstop. And Dr. G uses her hands when you're disconnecting, and I feel like I do the same thing, but it is so true. So with the adrenal glands, we can talk about the adrenal glands for hours. That's more of the side of excessive cortisol. The flip side, when the adrenal glands are burnt out or an immune response has happened against them, and we're talking more like Addison's disease or adrenal insufficiency from Addison's disease. Tell us about adrenal insufficiency and the work that you've done doing research on adrenal insufficiency and steroid pumps. So Dr. G's kind of a boss when it comes to Addison's disease, and it's a very delicate thing that you've mastered, and people follow your lead in this. And so I want people to learn about it. So tell me about adrenal insufficiency and your work in it.
Sure. Adrenal insufficiency can be from destruction of the factory,
Okay.
or it can be from the destruction or inefficacy of the bosses. So it can be hypothalamus or hypophysis, pituitary, for example, pituitary tumors or hypophysitis, inflammation of pituitary. So either of them will cause adrenal insufficiency, but only the adrenal insufficiency that caused by destruction of actual factory of adrenal glands, that will be called Addison's disease. And they have slightly different presentation and slightly different treatment, but main treatment is replacing of glucocorticoids, which is cortisol. And some of my patients, they do not absorb, or their hydrocortisone pills, that replacement of the cortisol, may not work. And because of that, we started using, more than 10 years ago by now, cortisol pump. And back then, it was interesting. I was looking through paperwork. There was only 6 people in the United States who used cortisol pump, and I had one of those patients. And from that point on, I have now more than 30 patients who use cortisol pump. We use insulin pump for the delivery of hydrocortisone, and we try to deliver it in circadian and ultradian rhythm. So circadian is when we have highest level of cortisol in the morning and go lower, lower, lowest, as it's supposed to be by nature, designed by nature. But a few years ago, we started doing more ultradian rhythm, where cortisol is spiked in small, tiny pulses every few hours. Many times those pulses relate to the food, relate to the stress. And so we are trying to mimic that. And that way people get closest to what nature designed a replacement of their adrenals or of their cortisol. Of course, it's not always 100%. We're doing our best, but it's still much better for many people who started using the cortisol pump. And they found that they don't have the super morning fatigue that was present when they were just on oral agents. And they're able to, their quality of life is much better. So it is definitely a topic of my interest and topic of my research. Presented that information last year in Endocrine Society, and continue to accumulate the data. So
it's a really special thing that you do, because a lot of these patients, the life expectancy is short because of how fragile they are.
Correct.
And you have taken that to a whole new level for a lot of people. And so
yes, that's definitely very grateful to come across the research from before and help many people as well, and hoping to teach more providers to do that and spread the word and help other patients with adrenal insufficiency.
what would be something, and that's really I want to segue into that. There's a lot of clinicians who don't understand adrenal insufficiency, and providers in the hospital setting, and we've seen this. We've had patients go into the ER, and you're very careful of, are they getting their steroids, because people don't understand it. So what should any clinician anywhere know about adrenal insufficiency and taking care of their patients?
So many providers afraid giving steroids. And I understand that, because if we give too much, people will end up with something like Cushing's created by the medication. And Cushing's has negative connotations. It will be associated with elevated blood sugars, elevated blood pressure, osteoporosis, weight gain, and depression, anxiety, and so on.
Cortisol, yes.
So it's exactly the same as happens with excessive cortisol. But if you are not going to give steroid on time, that can kill the person. So it is important to provide the steroids when person needs that, and provide IV fluids and all kind of supportive treatment, and not be afraid of doing that.
Delaying it.
because delaying it can cost personal life. And I'm part of the Facebook group for adrenal insufficiency. Every month we do lose patients related to adrenal insufficiency, unfortunately.
And it's a big passion of yours is really spreading the word of how to properly treat these patients and keep them from getting to that such delicate state. Because another thing I don't think people understand is when they get that low and they feel that bad, how hard it is to get them out of that hole.
Yes, and that injectable steroids very important. Occasionally, I have patients who come to me from different providers, and they haven't had even prescription for injectable steroid on hands because they were suggested to go to emergency room. And emergency room is great, but they don't always have timely administration of steroids. So for safety reason, everybody with adrenal insufficiency has to have injectable steroid. It's more like EpiPen or car insurance. You have your car insurance in hopes that you don't need it, but you still have it.
Just in case.
Just in case,
Yeah.
exactly.
No, adrenal insufficiency is probably our most delicate and acute critical thing that you would see in endocrinology. For the most part, a lot of things are a little bit more slow acting because hormones are not as quick to change, but cortisol is very, very delicate and short.
Correct. Yes. If you have, it's like Goldilocks. You have too little or too much, it's not good. You need to have just enough.
Yes. No, it's been so fun to learn adrenal insufficiency from you because I think today, the way that so many people are living in complete chaos and disalignment of their body's natural rhythms, though people are finding themselves in this state quicker and quicker. Yes, autoimmune Addison's is a little bit different than the bosses creating this problem, but
Secondary, tertiary adrenal insufficiency.
so what is primary, and we could go into all of them, but primary and secondary, like
So primary is when the factory is broken. Secondary is when the first boss doesn't work, which is first boss is your pituitary, and third boss is your hypothalamus, and it sits on top of the second or on top of the first boss, I guess.
so secondary.
The pituitary and hypothalamus is tertiary. We do see a fair amount of patients who develop tertiary because people are on steroids for different reasons. For example, I feel it goes underdiagnosed. People get steroid injections every 3 months. What does it do to your whole system? It puts you into Cushing's state. That's when you start developing the weight gain. And many people who require those injections, they are already less mobile because that's why they're getting those injections.
Yeah.
They get injections into the back, into the knee, or whatever other location. And they're usually less mobile because of that. They're disabled to some degree. And the hope that steroid will help with their mobility. And that frequently it does, but occasionally it doesn't. And people still keep getting that steroid injection every 3 months just to get 5 days of relief. But unfortunately, the opposite side of that is, as with all over supplementation of steroids, you get into that iatrogenic Cushing state when you start having issues with osteoporosis, weight gain, diabetes, high blood pressure, and so on. And that puts to sleep your boss at hypothalamus level.
And affects so many other things too.
Yes. And then you technically develop adrenal insufficiency because of that. And that's what we'll call tertiary adrenal insufficiency.
We would get patients who would come in with a crazy high cortisol or a suppressed cortisol and labs looked wonky. And it's the first question. Have you had a steroid injection?
Yes. Before that test done.
Yeah. But that's exactly what it does. So when you look at it in a chemical aspect on paper, you can see exactly what these steroid injections do. They're such a Band-Aid and they kind of break down the joint, but they also have a bigger kind of debt to it when it comes to hormones. It's so deep to what the body responds to.
And unfortunately, it has debt to the actual bone in a joint. Many times it initially helps to reduce that inflammation, but then it starts robbing the bone from calcium. So that's partially why I started moving toward regenerative
Yes.
aspect. And that's why I learning more about regeneration of joints or face or whatever, because injections like platelet-rich plasma into joint is much more regenerative rather than steroids. One of the studies I like to quote, when people got injection into the joint with PRP and another group got injection with steroids. At 1 month, steroid injection produced a lot better results with reduction of pain and inflammation. By 2 months, they were exactly the same. By 3 months, steroids stopped working, but PRP actually kept working and improving the joint state.
Without the side effect.
Exactly. And no Cushing's, no adrenals effects, just regeneration. And that's why I am more into regenerative part of the medicine now, because I feel that's the future. Unfortunately, it's not always covered by insurance, or technically none at all.
Yeah.
But we have so many other aspects. We have exosomes, we have stem cells, we have PRP and other biologics that are exciting.
And they're incredible because your body's innate ability to heal, you're accelerating that. You're supporting its own beautiful medicinal mechanisms that we already have. So what are exosomes? Where do you use exosomes?
So exosomes, right now we use mostly for facial care and hair restoration, but you could have exosome treatment with exosomes that could be actually delivered through inhalation, and that will get into place in your body where it needs to go. The injectable exosomes are not legal in the United States, from what I understand. So we're not doing that, but everything else is a go. And application of exosomes, we have, again, to explain what exosomes are, because many people don't even know what they are.
No.
So they are parts of cells that they're like vesicles that carry messages from one cell to another.
Okay.
And those vesicles can carry different messages. So if you have a message that has a signal for your hair, for example, to start growing, start waking up, then your hair follicles will get awakened and you will have better hair. Same is with skin regeneration. The creation of different collagen types will be there. And with other versions of exosomes that you can inhale, it will get to place where your body needs it with inflammation. And those areas will start regenerating because they will get the message that, okay, time's to wake up. Let's go. Time's to heal.
How do you administer the exosomes for your hair, and how do you administer the ones for your face and your skin?
So there are different ways, and the simplest one is actually creams with exosomes. Usually they're plant exosomes,
Okay.
But the better versions will be if you do any kind of channeling, creation of channels in the skin. It could be done through the microneedling. It can be done with laser treatments.
So puncturing and making open.
Making channels through which the exosomes can travel, get sucked into depth of the skin, and start creating the effects. Yes.
Cool. So what would be your favorite regenerative procedure when it comes more to the aesthetic side that you like to do?
I love, at this point, probably combination of, we have great laser right now, and it has great effects on skin surface and deeper. Plus, I do like combining it with Selenius Derma PRP, which is technically Biofiller.
Let's talk about that. What is that?
Biofiller is a very cool procedure when you take your blood and you spin it. You separate one part is platelet-rich portion, and we keep it separate. And platelet-poor portion, we heat it for 5 to 8 minutes, and it becomes a gel. Then you cool it down and mix it together with PRP. And that gel, what becomes your filler. And you inject it anywhere in the face or into joint. There is a great study that showed that injection of PRP into knee versus PRP derma, which is gel with PRP mixed.
Yeah.
gel with PRP mix, Biofiller, became much better effect on the joint regeneration compared just plain PRP injection, because you create the scaffold from that gel, and it's, again, all of your own material. You're not introducing anything artificial, and your body starts healing so much better.
That is super cool. So it's almost like your body's own stem cells. Like you're using it in a way of like, kind of, but.
Yeah, correct.
And it just recruits growth factor. It gets your body healing a lot quicker.
Yes.
That's fun.